Bismarck Healthcare on History Talk, where we look at the people, places, and events that shaped our community. History Talk streams exclusively Thursdays at 10 a.m. on KFYR+. Bismarck didn't have a professional clinic or hospital until St. Alexius opened in 1885. It did have doctors with private practices, however, most of whom were former officers stationed at Fort Abraham Lincoln or Camp Hancock. One such case was the ironically named Dr. Benjamin Slaughter, husband to famous pioneer Linda Slaughter. Another well-known private doctor of the frontier was Dr. Henry Porter, who is probably best known as the only surgeon who survived the Battle of Little Bighorn. John Dunn's drugstore was one of Bismarck's first retail stores. Dunn's daughter, Fanny, would later become North Dakota's first female doctor, with an impressive list of achievements, perhaps even overshadowing her husband, Dr. Eric Quain, co-founder of Q&R Clinic. Founded in 1885, St. Alexius was the first hospital established in all of Dakota Territory. With the help of Abbot Alexius Edelbrock, the Benedictine sisters purchased the former Lamborn Hotel building on April 14, 1885. After remodeling the building and acquiring the necessary equipment and supplies, the hospital admitted its first patients on May 6th. Total cost for the building and equipment was about $30,000. It operated for a short time as Lamborn Hospital before adopting the St. Alexius moniker in 1887. They treated 65 patients during the first year, despite no formal medical training, at a standard fee of $1 per day. Most patients suffered from common injuries of the era: brawls, frequent horse accidents, drunkenness, deadly diseases, and others. Chief Sitting Bull and future President Theodore Roosevelt were noted patients of the Frontier Hospital. St. Alexius progressed under the administration of Sister Boniface, who took over leadership in 1892. She was instrumental in evolving it from a primitive, barely equipped frontier hospital into a well-funded modern healthcare facility. She replaced coal stoves with steam heat, installed telephones, and replaced handbells with electronic call bells. She administered St. Alexius until retiring in 1937, the same year of her death. St. Alexius relocated from its original home inside the former Lamborn Hotel to its present-day location in 1915. Its new hospital, which faced 9th Street, opened March 15th with 125 beds. St. Alexius employed 18 surgeons and physicians at the time. Also that year, St. Alexius graduated its first class of nursing students. A dedicated 4-story nursing school was built east of the hospital in 1925, appropriately named Boniface Hall. The program was phased out in 1960 when St. Alexius partnered with Mary College. One of the first buildings erected at today's University of Mary campus is called Boniface Hall. The Boniface Hall at St. Alexius was demolished in 1999 as part of a $12 million expansion targeted at improving the hospital's outpatient services. St. Alexius completed a $1.15 million 5-story north wing in November 1948. It added 54,000 square feet of floor space to the 1915 built hospital. A future 6th floor was planned but never built. In 1962, St. Alexius expanded with an L-shaped addition to the southwest, originally 2 stories. Much of this section later expands to 4. It primarily housed the psychiatric unit. Total bed capacity increased to 259, which won't increase again until the 1983 expansion. On June 25, 1975, St. Alexius dedicated a $7 million expansion with a 4-story addition to the south. Part of the expansion adds 2 stories to the 1962 addition. The multi-phase project first commenced in 1972. It added a new emergency room facing 10th Street, outpatient facility, radiology department, and a power plant. Established in 1902, Q&R Clinic is the nation's second oldest surviving clinic, behind only Mayo Clinic. Doctors Eric Quain and Niles Ramstead founded the clinic. The clinic was housed on the 2nd floor of a downtown bank until relocating to 221 North 5th Street in 1927. That building was expanded several times, in 1953, 1966, and 1973. Today, it is the City-County building. Q&R Clinic officially merged with longtime partner MedCenter 1 in 1993, now part of Sanford Health. Bismarck Evangelical Hospital was founded in 1907 and became the first hospital in western North Dakota to have an x-ray machine. The name changed to simply Bismarck Hospital in 1955, and then again to Med Center 1 in 1984. Sanford Health merged with Med Center 1 in 2012. Dr. Ramstead is credited with bringing the hospital to Bismarck as opposed to fellow contender Jamestown. His ceremonial cornerstone was laid in May 1907, but it wouldn't be until July 30th that the hospital board awarded a contract to construct a 100-bed hospital on the site for just over $100,000. Bismarck Evangelical Hospital admitted its first patients, 6 of them, on February 2nd, 1909, even though contractors were still completing construction. In those early days, competition between the two hospitals was almost non-existent. Instead, they complemented each other by offering services the other did not. Dr. Quain, co-founder of Q&R Clinic and frequent partner with Bismarck Hospital, was a surgeon for both hospitals, while also serving as chief of staff for Bismarck Hospital from 1939 until 1949. The first addition to Bismarck Evangelical Hospital was completed in either 1913 or 1914, followed by a second in 1917. New wings were added to the south and east during the 1950s, beginning with a 4-story addition in 1950 and dedicated in 1952. The other commenced in about 1953, first building out the shell for a new wing and fully finishing it between 1955 and 1956. In 1974, a $5.5 million expansion demolished much of the building constructed before the additions of the 1950s, but not all. Some was retained mostly for administration offices. A $500,000 heart center was added in the summer of 1979. Both hospitals completed major expansions in 1983. The City Commission approved vacating several blocks of city streets in the process: Thayer Avenue between 6th and 7th Streets, and between 9th and 11th Streets, in addition to part of Avenue A and 10th Street. Bismarck Hospital teamed up with Q&R Clinic for a $23 million expansion, almost $12 million of which for the clinic itself. It included a 5-story addition to the hospital and sprawling 6-story tower for Q&R Clinic built to the south, which resulted in closing the 600 block of Thayer Avenue. Initially, the hospital addition was to finish only the first 4 floors, with a shelled-in 5th floor for future expansion, but it was decided by the middle of 1983 to finish all 5 floors. This caused tension with competitor St. Alexius, but was ultimately approved by the North Dakota Health Council in November 1983. Groundbreaking commenced in 1982, and the joint healthcare facility was officially occupied on December 20th, 1983. Bismarck Hospital was renamed Med Center 1 the following year. The former Q&R Clinic became a joint city-county office building at that time. Before deciding to expand its existing facility, Bismarck Hospital previously sought to relocate from downtown. The first attempt in 1966 would have built a replacement hospital near Bismarck Junior College on land donated by Harold Schaefer. There was another attempt to build slightly north of that in the Grandview Heights neighborhood. Also completed that year, St. Alexius dedicated a 5-story addition immediately south of the 1962 and 1965 additions, expanding towards Broadway Avenue. The expansion vacated 1 block of Thayer Avenue and part of 10th Street. Construction commenced on the 125,000 square foot addition in 1981. The so-called Centennial Project was originally intended to be completed in 1985 to commemorate the hospital's 100th anniversary, but St. Alexius accelerated construction due to surging demand.
The project is called the Centennial Project because in 1985, St. A's, which incidentally was the first hospital in the state of North Dakota, will be 100 years old. The project will not only expand the facility from 259 beds to 313 beds, but will also add some new services and expand some present ones. The maternity department, for example, will expand from 15 to 25 beds and will have the capability of caring for the high-risk infant. There will be new heart care capabilities, more beds in the intensive care and cardiac care units, and more private surgical rooms.
The expansion included a new common area containing the gift shop and cafeteria, outdoor courtyard, helicopter landing pad, new ambulatory surgery department, extended maternity department, a new nursery, and obstetrical nursing unit. It was the first time since 1962 that St. Alexius increased its bed capacity from 259 to 313. It is also at this time that the iconic architectural arches debuted, which is incorporated into the hospital's logo. connected to the 1962 and 1975 era additions, was a 4-story glass atrium looking west onto an outdoor courtyard. The courtyard was accessible by the public from 9th Street. An outpatient surgery center began construction in 1987 that would fill the courtyard. Mid-Dakota Clinic is a primary care facility affiliated today with Essentia Health. It formed in 1971 as the result of merging 2 other local clinics, Capital City and Missouri Valley. Despite its long-standing history of cooperation with nearby St. Alexius, Mid-Dakota Clinic merged with Essentia Health in October 2022. Missouri Valley Clinic was first organized in 1949 to succeed the Ronan Strauss Clinic that operated since 1909. At the time of merging, Missouri Valley Clinic operated out of the same building that continues to house Mid-Dakota Clinic to this day, on the northeast corner of 9th Street and Rosser Avenue, directly across from St. Alexius. Originally standing 54 feet by 130 feet, the 2-story clinic was first constructed in 1953 for about $200,000. A $3.2 million addition was completed in 1992, which added a $2.4 million 30,000 square foot wing to its east and a skyway connected to St. Alexius. Capital City Clinic formed in 1956. It operated from the Cowan Drug Building until 1962, when it relocated into the former Admiral Hotel, which closed the previous December. The Admiral Hotel building was located on the east side of 6th Street, between Broadway and Main Avenues, immediately north of the former Lambourne Hotel that once housed St. Alexius. I invite you to check out my 2 Bismarck history books. They are available to purchase on Amazon and select local bookstores. Copies are also available at the Bismarck Public Library. Visit bismarckbook.com for more information. That was a look at Bismarck Healthcare, including St. Alexius, Q&R Clinic, and MedCenter 1. What local history topic would you like to be featured? Email historytalk@kfyrtv.com.